Hello, beautiful people, and welcome back to Ivy Body Aesthetics. Today, I want to talk about the best supplements for women to take, women from 25 and above. So, thank you guys for tuning back to my channel, and it's so good to be here. I have done extensive research and I just want to talk about this supplement because most of us miss out on nutrients, essential nutrients for our health, for our utmost health, okay, our general body function, and we lack in these nutrients, not knowing that most ailments, underlying sicknesses generate from deficiencies of the supplements. I mean, we get our supplements from food, yes, but let's be honest, most of them, by the time we put them in heat and cook them, they lose those essential nutrients. So women should tailor their supplements so they don't end up causing damage by taking too much, okay, and should prepare their body, like really want to fine tune your supplement regimen to the amount you're taking, supplementing, and in your diet. I mean, that's why it's called supplement, because even if you get it through food, sometimes you need to boost your intake because you're probably lacking in it, and the way you boost it is by supplementing. That's why it's called supplement. You supplement by taking this vitamins to boost the daily required volume that you need for your body, and so on and so forth. So yes, our bodies need specific amounts of nutrients to carry out even the smallest tasks of function. A healthy diet will include most of these nutrients our body needs, but let's be honest, the food we eat don't always give us enough, especially most of them that we cook. These nutrients, they deplete as we cook them. They deplete by with heat, fire. So I'm just going to tell a list eight important, like very important vitamins that we need as women, and what they do, why we need them, how to take them, what time in the day to take them, and why it's very important for our general body health as we get along. So please do not forget to subscribe and give this video a thumbs up and support this channel as we grow together. Thank you. So here are the list of the vitamins I'm going to speak on today, which is iron, magnesium, calcium, vitamin B's, all the B's, probiotics, vitamin D, zinc, and fish oil / omega-3. So stay tuned, and I'm going to comment on. So just a brief interlude on each one of them. Let's get into it. Iron. Women, especially those with heavy menstrual period, may benefit from iron supplement to prevent iron deficiency, which is anemia. Magnesium supports muscle and nerve function, helps regulate blood sugar level, which prevents diabetes, and can ease symptoms of PMS, premenstrual syndrome. Calcium. Women need adequate calcium to support bone health, especially as they age. Vitamin B's like B6, B12, biotin play a role in hair growth, production of energy, skin health, okay, and probiotics helps with our gut. It's essential for overall well-being, and probiotics can support a healthy balanced gut bacteria. We'll dive into it one after the other. Vitamin D is crucial for bone health, immune function, overall wellness. Many women may have insufficient levels, especially in regions with limited sunlight. We don't need that one in Africa. We have plenty sunlight here. Okay, so let's get into it. And the first on our list is folic acid. Folic acid is actually the industrial form of folate, and you can find this natural folate from foods like broccoli, Brussels sprouts, dark green leafy vegetables. Specifically for Nigerians here, you find it in pumpkin leaf, which is ugu, or bitter leaf. I love drinking bitter leaf water, squeeze it and drink it. You can find it in asparagus, cauliflower, avocado, otherwise known as butter peas, soya beans, nuts, and seeds. Okay, why is folate important? Folate is for our cells. We need it for cells regeneration to make DNA, and without DNA, cells wouldn't function properly. So, nor will it form new cell tissues, for skin and for hair. Folate is also a key nutrient the body needs to metabolize amino acids. And women who are pregnant during pregnancy, especially the first couple of weeks, are advised crucially to go to take folate or folic acid, because it sort of like prevents abnormalities in the fetus, such as spina bifida, otherwise known as tube defect, that causes that affects the spine of the fetus. So that prenatal period is so unique to our needs for women to take folic acid. And it helps with your skin, it helps with your hair. It's best for your health. So with your health, part of the benefits is your skin and your hair. I know we talk about skin a lot here, but just know that when your health is intact, the benefits also transcends to your skin as well. So why not just make your health better and get part of the benefit, which is your skin? So you can get it in watermelon, lemons, banana, oranges, beans, broccolis, lettuce, spinach, and so on and so forth. Moving on. Next on the list is calcium. Calcium is essential mineral found in high amounts in milk and other dairy products, cheese, as well as fortified foods such as oranges, nut milks. They have added calcium. Typically, about 1 to 2% of female body's weight is calcium. Per research, calcium is synonymous with bone health, which can become a problem for females' bodies much sooner than males. According to a study, females have lower bone density than males, regardless of nutrition. Older women are also at higher risks of developing osteoporosis than men because of hormonal shifts during menopause. It directly affects your bone density. So, calcium is very important. Almost all your body's calcium is found in your bones and your teeth. So making it an essential nutrient for the bone health, it's of utmost importance. Calcium is super important for females starting at the teenage age. As much as 90% of adult bone mass is achieved the age of 18, and the peak for this occurs within your 20s. By the time a female is in their 30s, their bone mass usually begins to decline. Menopausal and postmenopausal individuals also need calcium because bone loss tends to accelerate as the body produces less estrogen. So calcium can be found in milk, can be found in cheese, almond, pumpkin, fig, sweet potato, parsley, tomato, broccoli, cabbage, spinach, white beans, soybean, and the list goes on. So that's the importance of calcium, and the food you can get the natural form of calcium as well as supplement, and that's why supplement is good as well. The next is vitamin D. Vitamin D is a fat soluble vitamin that our bodies can make on their own when exposed to sunlight. It's also found in vitamin D fortified foods such as milk, pork, cod liver oil, liver, eggs, butter, mushrooms, sardines, fish especially. Yeah. Why is vitamin D important? First of all, vitamin D helps our body absorbs calcium. Our bodies can properly use calcium without it. It enables the immune system to fight off viruses, bacteria, and some studies also suggest vitamin D deficiency could link to depression. So it also serves as a mood booster. And according to some reviews and research, it shows that the evidence clearly suggests the relationship between vitamin D, and depression. But more research is still needed to, fully understand how this affects all women, especially the following those women do not that do not regularly drink milk, who are lactose intolerant, or do not eat dairy food, fortified products with vitamin D, they need it. Those who don't get much direct sun exposure to sunlight, women who are over 50 years of age, that becomes much less efficient at processing vitamin D. People with disease that limit fat absorption, such as Crohn's disease, and also ulcerative colitis, ulcer precisely. Individuals who are pregnant and breastfeeding. Yep, so this is why vitamin D is important. So by the time you get to the advanced age of 40s, mid 40s to 50, in fact when you get to a menopausal age, it's best to start supplementing. And you can even start even before then, from your 30s, to start supplementing, because this can help with mood, to boost your mood, and helps to put away depression and all that. So yes, this is the importance of vitamin D for us as women. Next is fish oil, otherwise omega-3. Fish such as mackerel, trout, herring, sardines, tuna, salmon are all a rich source of omega-3, namely EPA or DHA. These are highly specialized fats, can't be made by our bodies. The fats are a key part of structure of cell membranes and provide a strong point for hormones and regulate blood clotting. They call it the heart protector. Fish oil is called a heart protector, and it's called that for good reasons. Okay, so it prevents blood clotting, contraction, and relaxes the artery walls. Helps with inflammation as well. So why is fish oil important? Omega-3s are essential for heart and blood vessel health, and for reducing circulating triglycerides to lower heart disease risks. So people that need this omega-3 are those who, especially women that don't eat fish several times a week regularly, and those at increased risks of heart disease, especially those who have elevated triglycerides, a type of fat that is found in the blood. Women who are pregnant and breastfeeding needs fish oil. Anyone with joint tenderness or rheumatoid arthritis, they need fish oil. And even pregnant women are advised to take fish oil, because it helps with the baby's brain development of the brain and development of a healthy heart. So this is the importance. And you can find, if you're not supplementing with it, if you want to take the natural form of it, you can get it from pumpkin seeds, papaya, avocado, flaxseed, kidney beans, sunflower, hemp seed, salmon fish, tuna fish, and so on and so forth. Next on the list is iron, and they call it the blood builder. Iron is one of the most common nutrient deficiency in adult females, iron deficiency or anemia. Anemia affects as many as up to more millions of women all over the world. Why is iron important? It is a mineral that enables the blood to carry oxygen throughout the whole body. Everyone's body uses iron to make two blood proteins, one called hemoglobin, carries oxygen from the lungs to the rest part of the body. The other, called myoglobin, carries oxygen to the muscles. So, who needs it? How much iron in a person needs depends on the host of the factor, including age, including sex, male or female, whether you eat a plant-based diet or you supplement. For women that have heavy menstrual flow, being active, pregnancy, can all be factors that can cause someone to have low iron deficiency. They also need more iron for pregnant women. As pregnancy progresses, they need more iron. So, and calcium supplements can also interfere with iron absorption. So if you're taking both, the calcium and iron medication, you have to take them at different times. If you're worried about your iron levels, please visit your doctor, get them checked. Okay, get them checked. And how do you get iron if you don't want to supplement? You want to get the natural form of it from your diet. You can get it from meat, lean meat, not fatty meat, okay, not tozo, lean meat. The seafood, poultry like turkey, chicken, but iron naturally occurs in white beans, lentils, spinach, kidney beans, peas, as well as nuts, some dry foods, and like raisins, peach. Next on the list is magnesium, and they call it the body regulator. Magnesium is a mineral that is abundant in most food, but despite this, half a million or more millions of women are deficient in magnesium. Why is magnesium important? It's a powerful mineral that is involved in more than 300 enzyme systems that regulate biochemical reactions in the body. Everything from protein synthesis to muscles and nerve function, blood glucose control, blood pressure regulator. Every organ in the body requires magnesium to function. That is why it's called the body regulator, because it regulates the body. The body can't properly metabolize vitamin D without magnesium, and it's also important for calcium absorption. Everyone but active women may need more. Sometimes if athletes experiences cramping, while it can be electrolyte, it can also be magnesium deficiency. So magnesium could also help alleviate menstrual cramping. That's why it's important for women. Chronic gonorrhea, gut inflammation, diabetes, and diarrhea. Females from the age of 19 to 30 years, in fact, from the age of 19, because that's when most women start getting their menstrual flow, needs magnesium. But it's a body regulator, so it doesn't have to be because of your menstrual flow. It could be for other things I've listed. If you want to get it from the natural source, from food, you can get it from green leafy foods, banana, eggs, peanut butter, chocolate, brown rice, almond, ugu leaf, bitter leaf. It prevents migraine, it improves digestion, and it heals stress and anxiety, and it helps with depression as well. It helps because it helps absorb calcium. It's also good for your bones, and it lowers blood pressure as well. And like I said, it helps with depression, so it lowers blood pressure and all that. And you can get it from nuts as well. Basically, it's just a body regulator. Like the whole body, everything in your body needs magnesium to function, to get regulated. And these are some of the reasons why women need magnesium, because it supports and help combat stress and help combat depression. It's important for bone density because it helps you absorb calcium, and it supports your heart health, improves your sleep, reduces menopause side effects, and alleviates PMS symptoms, premenstrual syndromes. So magnesium is good for you. Next is zinc. Zinc is a nutrient required for so many body functions, from immune system booster and blood sugar regulation, maintaining a healthy metabolism, and so much more. It only takes a small quantity of this mineral to reap the benefits, because zinc is a trace mineral, meaning you only need to consume very, very small quantity, and it's enough for optimal health. You can absorb metal through zinc-rich food, and like oysters, poultry, oats, or in the supplement form. Zinc helps to maintain a healthy immune system, helps to fight this viruses infected or cancerous cells, please speak to your doctor on that one. Basically, zinc deficiency compromises your natural immune defenses, making you more susceptible to illnesses, which is not good. Zinc keeps your blood sugar stable, and zinc helps your body heal, and it keeps the digestive system running smoothly. Zinc helps you taste your food. It's very crucial functioning taste perception, namely because the mineral is found in the gustin, a protein in your saliva. Decreases in the secretion of gustin have been linked with abnormal taste bud development and loss of taste. These symptoms of zinc deficiency takes a gradual hold and can be subtle. So the best way to catch it is by engaging in mindful eating of food that is rich in zinc. Zinc might help you pay attention. It helps with your behavioral changes. People with deficiency of zinc deficiency need to they have problem with mechanism, concentration, identifying object, because they are low in zinc. So it helps with concentration and cognitive. So zinc keeps your metabolism going strong. When you don't have enough, you can experience reduced energy, sluggishness. You might also have a harder time losing weight. Okay, so just remember, don't load up on the supplement. You just have to take a little and you're good. Just a little, so no need overdosing on it. It's basically, and the topical form of zinc is good for sunscreen, protects you from the UV rays of the sun, and it helps with acne. It boosts your eye health. It promotes muscle, helps with wound healing, promotes your heart health, immune system, reproductive health for pregnant women or women trying to conceive, and it supports your cognitive function. Concentrating, pay attention, listening, and your taste buds. All right. The last but not the least is probiotic. Everyone is saying you need them, or most people don't even know about probiotics. Okay, what is probiotics? Probiotics is simply a live microorganisms that live in your guts. Okay, people think that it's called a bacteria, but a healthy bacteria that kills and gets rid of the harmful bacteria in your guts, in your stomach lining. Probiotics are actually there to provide health benefits for you. Don't get fooled by the name because it says bacteria. Okay, but sometimes you need a little help from outside sources in order to secure those benefits, which is why a lot of experts recommend getting an extra hit of probiotics through your food. Fermented options, for instance, we in Nigeria will say pap akamu. Pap akamu is a fermented corn. It's a fermented version of corn. Even fufu has probiotics in them. Yogurt, Greek yogurt, contains probiotics, which is very, very important, especially for people with ulcer. But please, if you have ulcer, you suspect you have ulcer, please kindly see your doctor, kindly see a professional, a specialist, before you start supplementing on anything. So probiotics, what does it do? It keeps your other organs healthy, and the guts, which is what probiotics help with the most, interacts with the brain and lots of other organ system. Eating healthy food so you have a healthy gut microbiome is key to lots of different illnesses. Your gastrointestine. They help with your gut health. As you probably know, probiotics are mostly used to maintain your gastrointestinal tract, keeping it healthy and functioning properly. Such as bloating and being gaseous and all that. If people have normal gut function, they are happy with it. They are not bloated. They don't have any issues But if everything is working well, they don't need to take it every day. You can take it like once in two days, every other day, not every day. Probiotics prevent urinary tract infection as well. It's a immunity booster. If you get sick often, probiotics might help boost your immune system. Yes, and they restore good bacteria in your stomach lining. Antibiotics can help fight off bacterial infection, but overusing them can actually deplete the good bacteria in your body. So taking probiotics will help build this good bacteria that help you fight the bad bacteria in your gut and in your system. Probiotic prevents diarrhea. It helps with diarrhea and the bacteria that causes diarrhea. They improve fertility for women who are trying to conceive and can be tough. Probiotics is another helpful supplement that can boost their chances of conception. Please seek your doctor's advice for this. Okay. And probiotics treat vaginal infections, and probiotics can ward off vaginal yeast infection or genitalia infections, bacterial vaginosis by keeping the vaginal microbiome in balance. Please still go run a test, okay? Don't just supplement over the counter, go run a test. And probiotics clear up skin problems. Your skin can benefit a lot from probiotics. The benefit of probiotics don't stop for internal health alone. They can help with skin issues such as acne, rosacea, eczema, and more. So and they boost your digestive system as well. Your guts. You can find it from yogurts, like I mentioned, pap, akamu, Greek yogurt, and kefir, fermented food basically. So yes, ladies and gentlemen, I think this video has been long enough. I'm so sorry if I just dragged it on, but this is a health benefit to every one of you out there. If you suspect you have any underlying illnesses, kindly seek professional advice. Go see a professional, a doctor, not just a supplement. But this video is just to help you to know those supplements that can boost nutrients, vitamins, and optimal health benefits for you generally. Okay, they are not curative, they don't cure any diseases, they just boost your health. If you have any problem, please go see a professional, and please do not forget to subscribe to my channel and give this video a thumbs up, and I'll see you in my next video. Thank you so much. Take care.